Today I am doing a focused neuro exam. I've already introduced myself to the patient. I would wash my hands and provide privacy for the patient by closing the door or pulling the curtain. So today we're going to go ahead and get started with the neuro exam. We're going to start with cranial nerve 1, which is testing the sense of smell. So I have an object here for the patient to smell. I'm going to have to close her eyes. Close your eyes. And I want you to sniff this. Okay. Tell me what you smell.
Sweet cinnamon.
Okay. And it was cinnamon, so that is intact. We would also want to do a tasting test, which I would normally do with different taste in a normal setting. Now moving on to cranial nerve 2, we're going to test the patient's visual fields and visual acuity. So first, by doing that, I'm going to have the patient looking straight ahead at me, and I want you to tell me how many numbers I'm holding up when I hold them up. Just with
2,
your eyes.
3,
1. Don't move your neck.
2, 3,
Just your eyes.
3.
Okay. And then also in a normal setting, I would test visual acuity, and I would do that with a Snellen chart. I would have the patient stand at least 20 feet away from the chart, and then they would read it with one eye and then the other and then with both. And we would get a visual acuity for that patient to finish testing for cranial nerve 2. Moving on to testing cranial nerve 3, 4, and 6. We're going to start by having the patient follow this pin with your eyes, don't turn your neck. And here we are looking for the patient to track the pin with the eyes in all 6 fields. And then I want you to keep staring at this pin and follow it with your eyes. Very good. And here we are looking for accommodation, constriction, and the crossing of the eyes at the nose, which she did that. And now I'm going to test the visual, or the constriction and dilation. And in a normal exam, I would have like a regular pen lamp, but I don't have one, so I'm going to use this. So I'll have the patient look straight at me, and we're shining the light in the eye, looking for constriction of the pupils here, which she did. So moving on, that's normal finding for cranial nerve 3, 4, and 6. So we're going to move forward to cranial nerve 5. We're going to have the patient clench your teeth, and now try to open your mouth, open your jaw all the way. Very good. So the patient was able to open her mouth against resistance. So cranial nerve 5 is intact. Moving on to cranial nerve 7, which is the facial cranial nerve. So I'll have you smile really big, close your eyes tight, now open, and puff your cheeks out. And those are all normal findings. Moving on to cranial nerve 8, we're going to test the hearing. So this test I'm going to do by closing one of the patient's ears and whispering a phrase into the right side, and then I would do it again to the left side, saying different phrases. So close your ear hole and tell me what you hear.
Apples and bananas.
Okay. And then this side, cats and dogs.
Cats and dogs.
Okay. So that was a positive or a normal finding for cranial nerve 8. Moving on to cranial nerve 9, I'm going to have the patient say ah. Stick your tongue out and say ah. Very good. And then if this were a normal test, I would have a tongue depressor as well, and I would be able to test the patient's gag reflex with a tongue depressor. And then now we know that the patient's cranial nerve 10 is intact because she's able to speak normal and fluently, and she's able to swallow. So moving on to cranial nerve 11, we'll test by having the patient move her head from side to side. And this way. right and left, and then up and down. So that is intact. And then cranial nerve 12, I'll have you stick your tongue out and move it from side to side. Okay, and that was also a normal finding. So we're going to move on to the sensory and motor part of this test. So I'll have you put your hands on your lap and then turn your palms up, and you keep doing it and go faster. So that is a normal. Now hold your arms out straight in front of you. Close your eyes. We're looking for any kind of drift here, and that's a normal finding. Okay, put your arms in. Now squeeze my hands. Ow, my brain.
I'm sorry.
I'll go to your elbows. Now try to push against me. Okay, now try to pull. Okay, I'll shrug your shoulders. Good. Okay. Now I want you to hold your hands out, and I want you to touch each finger to your thumb. I'll try to speed up doing fast. Very good. And when we're doing these tests, we want to make sure we're testing both the right and left sides. So now hold your hands out again. At this point, I'm going to go ahead and test the reflexes. So in a normal exam, I would have a reflex hammer, and I would test the bicep tendon. So not the reflexes, but the tendons. So I'd test the bicep tendon here, the tricep tendon here, the brachioradial tendon, and then I would do the other side as well for those. And then we would test the patellar tendon just below the knee, just below the patella, and then the Achilles tendon right behind the ankle with the reflex hammer, and I would do it also on the other side. Also at this point, I'm going to use the end of the reflex hammer here, and using the bottom of the patient's foot, I'm going to stroke the end of the reflex hammer up, and we're looking for a curling of the toes or a reaction, and that is the plantar reflex. We also are going to test for ankle clonus here. I'm holding the back side of the patient's leg and the foot. Let me see if we can make her see this. You can't see it. And I would we want to jerk the patient's foot and make sure that there's no pain. So that's testing for ankle clonus. Okay, sorry. Okay, so after we do that, we want to start with our sensory test. So I'm going to start with an object, and I'm going to ask the patient to tell me, or close their eyes and tell me if they feel a soft, dull, or sharp sensation. So closing your eyes. What do you feel?
Soft.
Okay. Next.
Dull.
Okay. And one last object.
Sharp.
Okay. And now, if you'll hold your hands out for me, I'm going to close your eyes, and I'm going to place an object in your hand, and you tell me what's in your hand.
Money. Coin.
Okay. What was it? Coin. And one more.
Pen.
Alright. Now I want you to hold your hands back out, close your eyes. I'm going to draw something in your hand. I want you to tell me what I'm drawing in your hand.
8.
Okay. good. Now we're going to test for 2-point discrimination. So I want you to close your eyes, and I'm going to touch you on your arm, and I want you to tell me if I'm touching you in 2 places or 1.
2. 1. 2.
Okay. And we would want to note when the patient felt only 1 point or 2. Okay. So now I would also, in a normal exam, have a tuning fork. I'm just going to pretend with this. We're going to test for vibrations. So I would strike the end of the tuning fork, placing it on the tip of the patient's finger, testing for vibration again, and then strike the end of the fork and testing for vibrations on the great toe. And I would do also the other side, a finger and the great toe as well, testing for vibration. Next, I think we can test for your balance. So I'm going to have you stand up. Okay, I want you to turn and face the thing. Okay, standing straight, close your eyes. I'm going to give you a little push. And patient should have normal balance or maybe a little bit of swaying. That's the Romberg test. We're testing for balance there. And then I'll also have you, we're going to walk a few steps, so you can start over there and walk towards me. Just walk normally. And I want you to close your eyes and take a few steps backwards. Okay, stop. Now if you'll walk heel to toe towards me. Whoa. God, you failed the test. And in that test, we're looking for balance and stability on those. Also, in a normal exam, if this on a male patient, I would test the cremaster muscle, and I would do that by having the patient stand. They would be undressed, and I would stroke the inside of their thigh, looking for a pulling upward of the scrotum, and you do both sides. Also, at this point in the exam, if this were in a normal environment, I would have the patient lying flat on the exam table with their abdomen exposed, and using the end of the reflex hammer. I would, starting at the umbilicus, stroking from the umbilicus outward in many directions, testing the abdominal reflexes, and if it's a normal finding, the umbilicus should pull in the direction that the reflex hammer is going. Okay. And then I just have a few questions for the patient. Can you tell me what day it is?
November the 8th, 2021.
What day of the week is it?
Monday.
Who's the president?
Biden.
Can you tell me what a bed, a chair, and a couch are?
Furniture.
Can you tell me what this is?
A pen.
Okay. And then I would ask the patient if she had any questions or any concerns, and that would conclude the end of the exam.